Welcome, everyone, and hello. Thank you for joining us today. My name is Jennifer Bernard, and I'm the president and CEO of Women's College Hospital Foundation. My pronouns are she and her. We're so pleased to have you with us today for our In Conversation with Pride Toronto. Before we begin, I'm going to start with our land acknowledgement. I'd like to take a moment to acknowledge the land upon which we are gathered here today and acknowledge Toronto as a sacred gathering place for many Indigenous people of Turtle Island. With much respect, we uplift the sacred diversity of the original First Peoples and caretakers of this land where we live and work and thrive on. I'm joining you today from the ancestral homelands of the Adirondacks, the Huron-Wendat, and the Anishinaabe, the Mississaugas of the Credit First Nation, and the Haudenosaunee territories and nations, home to dish with one spoon. This treaty is based in stewardship, reciprocal sharing, sophisticated governance, and healing practices, which extend to all nations living here today. We acknowledge the Indigenous people across the many territories you all live and work on as well, and in all their unique expressions, richness, knowledge, lived experience, and history. Okay, we're going to start with a bit of housekeeping so that everybody knows what to do and what to expect. So we have your videos and your microphones are all automatically muted, so you don't have to worry about that. The Q&A box is down below, and please feel free to ask questions throughout the event. We'll keep some time at the end for question and answer with our wonderful panelists. I'm going to start off the day with a few opening remarks, and that's because although many of you are familiar with the topics that we're going to talk about, we hope that there are people that have come here to learn and be allies and supporters and just open up their own knowledge base about our discussion. So I'm going to set up some context, and then we're going to jump right into our discussion with Dr. Stratton and Yuri. Dr. Stratton has given me permission to call her Laura, so after I introduce her, I'll be switching over to that. So today I'm thrilled to be joined by our two guests for our discussion, which is presented in partnership with Pride Toronto. Dr. Laura Stratton completed her medical school training at the University of Toronto, Mississauga, and her family medicine residency at Women's College Hospital in Toronto. After her family medicine training, she pursued an enhanced skill program at the University of Toronto in LGBTQ+ health. Dr. Stratton currently provides comprehensive primary care to patients at Women's College Hospital Family Practice here in Toronto. She also provides virtual care to trans and gender diverse patients across Ontario at the Connect Clinic. She is a lecturer in the Department of Family and Community Medicine at the University of Toronto and is involved in teaching trans and gender diverse care to current family medicine residents. Dr. Stratton's pronouns are she and her. And now to our other guest, Dr. Yuri. I just made you a Dr. Yuri. Yuri Hernandez is co-chair of the board of directors of Pride Toronto. Yuri began their life in Cuba and immigrated to Canada in their teens. They identify as non-binary, queer, trans immigrant. They are incredibly committed to advocating for any and all marginalized communities. With a background in community and corporate engagement and a diploma in family and community services, what stands out about Yuri is their process-driven nature and ability to lead and engage corporate and community groups with a strong focus on simplifying transgender services. Yuri's pronouns are they, them. All right, it's wonderful, wonderful, wonderful to have you both here. I was just saying that this is a long time coming. We had a wonderful in-person conversation when we started our transgender surgical program back in 2019, and we've been so hoping to bring back Pride and talk about primary care for the transgender community. And this latest edition of In Conversation coincides with Trans Awareness Week, which occurs every year between November 13th and 19th. This week serves as a time to celebrate and honor the trans community and raise awareness and greater visibility around the continued adversity trans people continue to face in our society. Trans Awareness Week culminates every year with the Trans Day of Remembrance on November 20th, which was created to commemorate all trans people lost to violence since the death of Rita Hessler, a Black trans woman who was killed in Boston, Massachusetts in 1998. Canada is the first country to collect and publish data on gender diversity from a national census, and undertaking that only began in the census of 2021. So we have a long way to go. According to the most recent census, 1 in every 300 people in Canada aged 15 and older are transgender or non-binary. And in 2016, the Ontario Insurance Plan, which we know as OHIP, changed the funding criteria for transition-related surgery to align internationally with accepted standards of care for the health of transgender and gender diverse people. This allowed qualified health providers not only access, but to refer patients for surgery, but also to apply for OHIP-covered funding for these surgeries. Until then, these surgeries were only done in clinics where people had to pay out of their own pocket. Women's College Hospital was pleased and delighted to become a hub for surgical services for gender transition surgeries in Ontario, providing expanded services in various transgender surgeries and the secondary facility in Canada to provide genital surgery. So I want to make sure everybody understands that we provide transgender surgeries, as well as we also provide genital surgeries. The transition-related surgical program at Women's opened in 2017, and that was another wonderful trailblazing moment for the hospital, revolutionizing healthcare lies at the heart of everything we do here at Women's. And this discussion is about taking action around a central issue about creating equity in the system so that it serves everyone. There are lots of health gaps for everyone in the system, and today we will be providing an in-depth discussion rooted in the lived experience of transgender people about the importance of self-care in the community. And this was something the community told us they wanted, and we're so pleased to respond. We'll be also addressing the importance of key preventive health measures, such as education and screening. So that was a long preamble, lots of information there, but we're going to dive into the discussion right now. So here we go. We're going to start with our very first question, and we're going to begin with Yuri. So Yuri, we want you to share your story of your own transition to sort of set the table for the challenges you encountered during this specific journey. Can you share your story with us to get us started, Yuri? You're muted.
Sure. I'm happy to share that story with you. So I started my transition in 2017, oddly coinciding with your program, but it was not through that. And it was a very difficult process. So in 2017, there was an assessment process that you had to go through. And you also had to be clinically, you had to be like a mental condition at the time for you to be able to transition and receive OHIP funding. So my assessment process was very long. And then even before that, finding a doctor that would provide me that process was even more difficult. I had a wonderful doctor beforehand, and I actually had to end my relationship with my doctor at the time because she was specializing in female sexual health. And when we started the conversation of, testosterone, hormone therapy, what are the different processes, the different assessments, she was so overwhelmed. She was very, very confused. And because of the good relationship that we had, she was very honest with me about it. She said that she wanted to provide me the best possible care. And she agreed that she was not going to be able to fulfill that mission. And she suggested that I try somebody else. And that was very difficult for me. I knew that it didn't come from a negative place.
Right.
I knew it came from a positive place, but sometimes that makes things a little bit more difficult to deal with, because you know that no matter how hard someone tries, they still can't support you. So yeah, I ended up ending that relationship. She had no suggestions for me, so I found my doctor through word of mouth. I called my doctor's office every single day for 60 days, left them a message or spoke to someone and explained the situation that I was in. So you could imagine the mental gymnastics that I had to do throughout this time to just convince myself that everything was going to be okay. And I was going to get there, which I did, but it was a lot of work. Yeah.
You've hit on so many things. First of all, the lack of knowledge within the general, medical community, and even doctors who really want to help, not having that base of information to support you. You talk about the amount of self-advocacy that you need to have, and have that resilience to just keep trying and knocking on doors. And I think where you started was, it wasn't even accepted that it was something that was a right. It was almost like a privilege, and you had to prove that there was something wrong with you in order to have this service provided. It just shows you how far back we were in terms of thinking about this as a human right and an equitable access being something all people should have. I can only imagine the frustration. So we're gonna switch gears now. We're gonna go to Dr. Stratton or Laura. And so can you talk a little bit from your point of view as a physician about the obstacles that Yuri, sort of touched on that people have to go through in care, trying to get the care and support that they need from your point of view?
Yeah, no, absolutely. And I mean, like Yuri's story and situation is not isolated or unique. There's lots of patients, very similar experiences to Yuri in terms of trying to access care, facing barriers. So your healthcare provider is saying like, oh, I don't do trans care, or I don't even know where to begin, and being overwhelmed. And so it's unfortunate that is the case. We look at like some of the numbers. So like Trans Pulse did a study across Ontario looking at trans and gender diverse individuals, and trans patients, there's 3 times more likely to have unmet healthcare needs compared to cisgender counterparts. And so many who don't have access to primary care. And so when I'm seeing patients, it's very common for them to tell me that they've been waiting months and months and months or years in order to access primary care. Again, searching online, looking at different forums, trying to find trans affirming healthcare providers. So again, spending so much time just trying to access us. And so when they are in touch with me or some of my colleagues, there's been many years where they're suffering and kind of mental health getting worse. And then comes this urgency in terms of accessing care and trying to get things done quickly. And in Yuri's case too, where if their healthcare provider did have someone to refer to, often these places that people get referred to have incredibly long wait lists. So anywhere from 6 months on a good wait list to up to 2 to 3 years. And so patients are waiting for a very long time. Normally referring is not a bad option when you don't feel comfortable or something's outside of your scope of practice. But in terms of trans care, when there is this awful wait and such limited number of providers, it's really like unacceptable and creating harm while waiting for care.
Yeah, and I think it's surprising to a lot of people because we pride ourselves on having this universal healthcare system where everybody has access. And when you say everybody, we realize it doesn't actually mean everybody. You're a relatively young doctor, have recently, in the last probably decade, graduated. What are people learning about gender care in medical school? Like, we find a lot of the issues start, at the root of like the training. Like, of course, you get to your doctor, they don't know what to say because am I right in surmising that the training just isn't there in school? Like, you guys are not getting that kind of
So I mean, things are changing. But like you said, I haven't graduated all that long ago. And even when I went through medical school, we had very limited exposure. So I think we have kind of short exposure in LGBTQ health overall in general. Right. So you can't do justice to covering trans, gender diverse care in such a short period of time. Even in residency, I mean, there's no standardized curriculum across like the country or province. Even within residency programs, it's so different from school to school. And so there isn't that kind of if it's not taught in school, then when you're out in practice, then you're thinking, well, I haven't learned about this. I don't know even where to begin. If I wasn't taught this is maybe something something that I'm not supposed to be doing, or
Right.
don't have the skills to do so. So things certainly are changing now in the medical education or medical school system, where there are increased teachings on trans health, and in residency, again, safe to cite, where I'm helping to train some of our women's college family practice residents. And there's lots of other programs out there for continuing medical education. So once providers are out in practice where they can learn, but it's on the onus to that healthcare provider to take the time to do that.
Yeah. So when we talk about systemic barriers, they start with, these archetypes, I think, of like who we're serving. And I think that what you both have identified is that the archetype doesn't include transgender or gender diverse people, and therefore there's nothing built around supporting them. Yuri, I wonder if you could talk a little bit, you talked about your story, but what is it like that time in limbo? Because it's such a long, journey, and you're talking about calling for 60 days. And how did you support your mental health during that time?
Honestly, it's by having a very, very close group of friends. I live in Canada alone. I don't have my parents here. I don't have a third removed cousin. I have nobody that is connected to me by blood here. So I've built myself a very, very, very strong network of people that I heavily rely on for very personal matters. So during that time, I was going through a lot. Just for some extra information, I was going through a divorce as well.
Right.
So there was just so many things on my plate that I really reached out and was able to lean on a lot of people that have supported me through my life here, because I just had no choice. So yeah, I was just really chatting a lot. Do you have time to speak with me? My work was a big support at the time as well, because I was very clear about the issues that I was going through. So they provided me paid time off. They provided me anything. They said, whatever it is that you need for this, we will give it to you. So little sentences like that, they relieve so much stress. When your job says, don't worry about it. Take whatever day you need. We will figure it out later.
Okay.
We're gonna
stick with your story and your advocacy, because I think in going through your journey, it really emboldened you to not just speak up for yourself, but for others. Can you take a little time to talk about, why you decided, this guy, I have to do more than help myself, and speak about, what you learned along your journey that made you really want to be an advocate for others?
Yeah, I mean, it's a self-advocacy piece. Even culturally, Cuban people are very, very extroverted people. We are social beings, and that's a huge asset for me. And it's a huge asset that I never thought that I had. I never realized that speaking up in a medical sense would get me somewhere further than someone else. When you often think of a medical environment or, a clinical environment, you think of fairness. Somebody comes in with a head injury, it doesn't matter if they're bald, black, white, trans, they're going to get that head injury fixed and taken care of. So it's seldom that you think that there's like this strategic approach to healthcare, in which you do have to kind of like wheel and deal in a way with your personality. And that is what I did, calling my doctor for 60 days. Not every trans person can sit on the phone leaving a voicemail that they're trans every day and that they can't get the care that they need. So again, like that should not be an expectation from someone. That is a major sacrifice, and it should just never be the case. But that is the biggest surprise to me, that I can wheel and deal my way to better care. And if someone that is more introverted than I and does not speak up as much as I can, they will be left behind with the current situation. They will.
Yeah, and you're right. It seems that the medical system would be, colorblind, blind to all the different things that are in a very, trans people, all the cross sections that bring people into the healthcare, but it's not, healthcare isn't blind and it isn't unbiased. And I think that's the biggest surprise to people, that it's not trusted and safe. I hear a lot about people feeling safe in hospital spaces in particular. We hear a lot of that in the Black community. We hear that in the trans community, feeling like they belong, seeing people that represent themselves. And you're right, without having those pieces in place, you can understand why people, lose hope. Let's talk a little bit, let's get into our theme about self-care. Yuri, what would you like to start with in terms of talking about why self-care is so important, and what does that look like for you specifically?
Sure. So yeah, just a little bit of context. I've worked in nonprofits for a very long time, and self-care has been, kind of a hot topic item because of that. But never did I really practice self-care until I started taking hormone therapy. Um,
Okay.
when you start taking hormones, I'm sure it's obviously different for everybody, but there are some changes. There are some changes to your body. There are some changes to the way that you think, and you just gradually change over time. And for some people, it's really hard to like resolve those feelings and those emotions, or
Mhm,
really understand like where they're coming from. Like, why
mhm,
am I feeling more agitated today than I did yesterday? Why is something that didn't bother me 2 weeks ago now like pushing me to like every? So for me, it became like practicing mental self self care and physical self care. So
mhm,
I never worked out. I never went to the gym. I never did any sort of physical things. Now I definitely do. I have those things in my schedule. I
mhm,
definitely take time to be active every day, and I take
mhm,
time to be mentally active as well. And what I mean by that is I sit and I think with myself. So
mhm,
I do a lot of self reflection, and I
mhm,
do that every week, and I do it on purpose because when I start a new week, I need to know that I'm at my best. Um,
mhm,
and you just created like a schedule with myself in which, yes, I sit down every week and I talk to myself. I confirm that I'm good emotionally. I confirm that testosterone feels good because I do my shots every week.
mhm.
And I communicate a lot with my doctor,
Okay.
a lot.
So
So
I want to start there because you sound like you're like the dream patient because you're so very self-aware. You seem to have real strong connection to your caregiver. Was it your caregiver that gave you these tips, or how did you come to the idea of I'm going to start working out? Where did you get that information from? I'm just trying for our audience to just sort of get a baseline.
absolutely. So my doctor, her name's Alison Charlebois. The way that her clinic works is every trans patient has a certain amount of doctors, psychiatrists, body, and several physicians. So, for example, if Allison is not available to speak with me, there are
Mhm,
three other physicians that will take her role.
mhm,
So, it is a combination of things, and it does come from having a really good healthcare team because um, they have been my primary caregivers in terms of the knowledge piece. They have given
mhm,
me all of the knowledge I needed. Allison has taken it very personally in terms of providing me with references, clinics I can go to. She
mhm,
connected me with Yolanda Kirkham at Women's
mhm.
College Hospital, who is
Yeah.
an incredibly talented, amazing. I could just go for days about how wonderful she is. So seeing that they had connected and that they had a really good relationship, I already knew that something was going on at Women's College because
Right,
they obviously were connected in some way. So again, these pieces didn't come to me. I didn't just sit in my living room and say,
right.
"Hey, this is what I need to do." This came from feeling a certain way and deciding to get information from my physician as to why I was feeling a certain way.
So
So
it sounds like you need an entire community around you in order to
yes,
make this work. It's not, you taking a few shots and everything and just coming out the other side. And I think that that's so important for people to understand. It's a journey, and you need lots of people on the journey with you. I'm going to bring Dr. Stratton back in. Laura, I want to talk a bit about from your point of view as a physician, the self-care piece. Some of the folks that are in our transgender program go through surgery, some don't. Let's talk about those who have surgical interventions, those who have hormone therapies. Can you talk about the components of healthcare that are key factors in the trans community?
Yeah, and I think it's like you identified, everyone's journey is going to be different, right? So it might
Mhm,
include surgery, it might include hormones, might be both, might be neither. Everyone's journey is going to be unique and going to have unique needs to them. I think sometimes within healthcare, it's easier to think of things in the binary and think of things in a linear sort of process that everyone has to follow, but that's not the reality. So everyone's going to be unique in what they need. And like Yuri mentioned, is not just one individual. It's not just, I mean, there's parts that I play as a physician, but I'm not the only person. Again, there's a whole other kind of team and community and supports to support patients. And so whether it's having mental health support, so honestly, I think everyone could benefit from a therapist or a counselor, let alone when you're going through transition, where it's
mhm,
a lot of changes that are happening So having those mental health supports in place, family, whether it's given family or chosen family, online supports, groups, having all of those people in place to support the individual.
So you've hit on something. I mean, this is such a personal journey. Everybody coming from different places, different lived experiences, wanting different outcomes. What are the sort of typical questions that you get as a physician around self-care that are more general, that sort of apply to everyone? Like, what's like the baseline that everybody that's sort of going through a transition should be thinking about? Maybe, and even in terms of preparing themselves, I would love both of you to answer, because I think when you get to the point where you're having the surgery or the hormone, that's a huge step, but just getting there is such a big journey. And so what are the things that perhaps, Yuri, you wish you knew then that you know now? And perhaps, Laura, what are the sort of 2 or 3 key things that every patient would benefit from in terms of self-care?
So for me, there was, I did spend a year in which I had breasts, and I also looked very masculine. And I wasn't really prepared for what that would look like in terms of like being out in public. It was very, very difficult for my mental health. Very, very, very difficult. So again, just kind of prepping for that time. And it's like, you're not going to get your top surgery right away. You will be on hormones for an undetermined amount of time. It is government funding. So you kind of have to be prepared to look not like your ideal form for an undetermined amount of time. So that was a big surprise for me. And then I would say taking vitamins. I know it sounds odd, but there's a lot of changes to your body. Taking calcium, taking vitamin D, your bones hurt a lot during the first couple of years. So taking those little vitamins, fish oil, makes a huge difference just in your overall body, and taking care of your liver as well. So I've definitely stopped a lot of the drink. I was doing a lot of, drinking and partying on the weekends. I don't necessarily do that anymore. I do find that my gut health has changed a little bit.
Right.
So there's something there to note too.
And you talked about starting to go to the gym and really exercise and strengthen your body, and you felt that that was one of those necessary pieces as well?
Yeah, it almost feels like an instant relief. It's like I said, I never felt that way before. I was never a sporty person, and now I like really look forward to feeling like relief. Like I feel like relaxed.
Okay.
In my body. Yeah.
That's wonderful. And Laura, what would you say, like your sort of top line advice for folks that are, as they're approaching perhaps some sort of transition or hormone therapy?
I think like thinking about what your goals of care are, like what are again, since everyone's journey is different, like thinking about kind of what you envision in terms of your transition looking like, and what you're hoping to see in terms of changes, and then going through like expectations. So kind of as Yuri mentioned too, like not knowing kind of timelines or kind of the changes that are happening. So having that opportunity to discuss with your healthcare provider, like what are the changes that are going to happen? What are the side effects? What can I anticipate that's going to happen to my body? And how quickly are things going to happen? And so usually with patients, I'll pull up a website and we'll go through together, like one by one on that list, like what are the changes that are going to happen, recognizing also that everyone is going to respond a little bit differently to hormones. So I can't tell you exactly how things are going to be. And so also recognizing that, yeah, we can't predict exactly how you're going to experience things, but at least having some sort of framework in order to know what's going to happen. And then thinking about what those challenges might be. And so again, we can't anticipate all of the challenges that might come up, but navigating just being out in the community and society with kind of your body changing, how to navigate being at work or with family, coming out to people. And again, we might not have all the answers, but kind of at least thinking about these things, trying to anticipate them and think about, okay, if things become more challenging or more difficult, then who can we connect you with to make that a bit easier?
One of the things, that the theme that has run through all of these conversations is mental health. And so I want to spend a little bit of time on that piece, because I think, it's so people think that you can change your body and, then you're done, and you can change your hormones and then you're done. or, you can physically what you look like, it's done. So Yuri, maybe I'd start with you on your journey. Obviously your mental health must have, played a big role. It sounds like it's a bit of a roller coaster ride. How did you sort of, I like to call it, guard your mental health? And, during this journey, I know you talked about your great group of friends, you have a group of physicians, but day to day, getting up every morning as you're transitioning and even beyond, what are your sort of tips around mental health that you'd like people to, hear about?
Sure. So for me, it was my reactivity. I was at the beginning for me of HRT, I was going from 0 to 100 very quickly. It feels like patience was just non-existent. So for me, it was just a reminder to not react. So I started I went to a psychotherapist.
Okay.
I spoke with them. I didn't like the idea of taking medicine, so I decided to just go to a therapist instead. And that's what I've been doing since. But aside from that, yes, I wake up and I talk to myself every morning and I say, how am I feeling? And I learned to establish that feeling. So one of the first things I learned to do is, how does my body feel? So when I'm starting to feel any sort of frustration or any sort of irritability, how does that display in my body? So I started noticing that I would get very hot before any sort of actual feelings came out. So yeah, that was like a very quick answer for me. I now know that anytime I get hot or bothered, whether I actually feel the emotion, I know it's coming. So I turn it off right away. And again, that works for me. But you don't get there unless you talk about it and talk about it and talk about it. And again, that's not a resource that we all have. But I definitely urge some people, if you have a social worker, please reach out to them and try to get yourself into some counseling just for any sort of unpacking. It will benefit you in so many ways.
And you continue to get mental health support despite the fact that you're pretty much through your transition?
There'll always be something to talk about.
And Laura, as people are, whether they're embarking on the journey, is it your recommendation, before they used to treat it as like a mental health issue. Now we know it's something that you need support for, because we all need mental health support regardless. So how does the medical profession work in the mental health piece with the transition?
Yeah, it's I think there's still a lot of room for improvement in terms of like mental health resources, and that's a whole other kind of discussion in terms of increasing mental health access and resources. And we're talking about like counseling and psychotherapy, but for a lot of people that's not actually accessible or available. A lot of times you don't have it actually covered. And depending on what clinic that you're part of, it might be built in. So here at Women's College Family Practice, we do have some social work support. But for a lot of people, that's just not really an option, or you don't have health coverage to access that. And so integrating other mental health supports in other ways, again, through self-care, exercise, eating well, just kind of having appointments with your family doctor, and recognizing that we should take care of all those other parts of your identity. Like gender identity is one component, but making sure we're not neglecting all those other parts of you, your other healthcare needs. Again, you can be sometimes so hyper-focused on gender identity and getting access to care, because again, there's so many barriers in trying to get access to care. So of course, it's going to take up a lot of your mental space and capacity, but making sure we're not neglecting all those other aspects of your overall health, whether it's preventative care, just other kind of healthcare needs, other interests that you have or hobbies, trying to still engage in those things. And then also relying on the community around you, whether it's again, family, friends, other kind of support groups that are out there.
Well, you've touched on something I'd like to move into now, which is, the other parts of your healthcare, or the parts that, complement what you're doing in terms of your transgender surgeries or your hormone therapies. And we're going to talk a little bit about screenings and regular tests and assessments. We know that during COVID in particular, everyone fell behind on their sort of regular appointments. And I would imagine in the transgender community, many of the appointments that they would have wanted to have were either delayed, or again, you talked about these long waiting lists. But there are tests that you should be having regardless, especially that are for cancer screenings. And we see very low uptake on these tests even during regular times. And during COVID, again, people either it going off people's radar, or they decided, oh, it must be too hard to get into the hospital to do these tests. I want to talk about tests like pap smears, breast cancer screenings for trans men. And what do you think the barriers are for these specific tests in these groups? And why is it so important that the trans community continue to seek these services?
Yeah, so lots of barriers, unfortunately. I think a lot of screening, again, we kind of divided in terms of women's cancer screening, men's cancer screening, which is great. And I think has absolutely its role in terms of these programs. But if we're only doing a kind of gender-based screening, then we're missing like the trans and non-binary communities. And so shifting more towards like an organ-based inventory or anatomy-based screening. So if you have a cervix and you're sexually active, then yeah, you need cervical cancer screening. Or if you have breast tissue, if you're a trans woman who's on hormone therapy and have breast growth, then yeah, you also need breast cancer screening, same as you would for a cis woman. And so I think how we do cancer screening and the kind of way the system is set up sometimes leads to barriers. So sometimes we end up using, for example, the OHIP gender marker or sex designation to make sure we're capturing our patients. And so if you're only using like the F gender marker and you have a trans male patient who hasn't changed their OHIP sex designation, which again is not a requirement that they have to change it on OHIP, then we might be missing those patients.
Right. Yeah, I see that as a huge issue.
Totally. And so
we've only started collecting data, as we said, in 2021, but none of the markers that would trigger, the right tests are actually changed to have, non-binary markers. So you must be missing those people. It's just like it's built into the system that those people would be.
So you have to find some other way to make sure that we're not missing these patients. And then that's also recognizing that you need that test. Some people don't recognize that they need those cancer screenings, or even healthcare providers don't recognize that certain patients still need certain cancer screening tests done. And so kind of from that knowledge perspective, where again, hopefully increasing the knowledge capacity within medical training to know that these patients need cancer screenings as well.
Yeah, you've hit on a really important point, because in this case, particularly for the trans community, the physician also has to be an advocate, because they don't fit into a box, right? Yeah. And the physician then therefore probably has to make that referral and says, no, this is a transgender man and they still need this screening. And I'm saying I'm sending them for a pap, I'm sending them for a breast cancer screening. Yeah. We are seeing at the hospital huge uptick in stage 3 and 4 cancers post-pandemic, and it's in trans people as well who miss their appointments. So I think we can't stress enough that self-care in this area and prevention in this area, or catching things early in this area, is life-saving. And so if nothing else comes out of this conversation, one of the things that we at Women's College Hospital want to do is make sure that the people listening know that we do have a welcoming environment. And I want to talk to Yuri a little bit about feeling like you belong in a place and feeling welcomed in a place. So Yuri, I don't know if you've gone for preventative screening, but I wondered if you could talk a little bit about any experiences you've had in our hospital or other hospitals that make you feel like you do belong, and that your needs are going to be cared for. Oh.
So I do my my yearly PAPs with my doctor. I also do checkups with the sexual health clinic near me. And I also will do stuff with a particular team at my doctor's as well. So it's fairly covered. I've also been to Women's College because my gynecologist is there. So I've received kind of low, I can't say it. I'm not going to say it right now, but I've received that kind of care there as well. And what I have to say, I mean, it's I think what you would expect. The city-run environments are very awkward, very difficult to deal with. On my healthcare documents, I have an M. There's no way to change it to an X. I have an X in the rest of my documents, but not on my healthcare ones. Don't know why that is, but again, Dr. Stratton just touched on it, so that was kind of a knowledge for me that I didn't know about. So that is probably why they've refused to change it. Yeah, that's just been about it.
Yeah, I mean, one of the things that, we're trying to do at Women's College Hospital, one is make sure that everybody feels like they can walk through the doors and will get the kind of care they want to receive, and that they will be seen as themselves and unapologetically so. And we're trying to advocate for that. That's why we really wanted to have the transgender surgical program at our hospital and make sure that there was a way that people who wanted that surgery could get it. We also have a compassionate fund to help support the things that are not covered by OHIP. There's so many things not covered by OHIP that are required. And I think, Yuri, you could probably speak to a few of those that are not part of, the OHIP coverage for the surgery. It's not just surgery. There's a lot of other things that need to be covered as well.
Yes, and I will say as well, something that I do want to point out from my experiences at Women's College Hospital has been like the inquisitive nature. Anytime that I've gone there, there's always been like an additional conversation about what else do I need? Can I provide more information?
Mm-hmm.
I'm a very open book, so I've always said to Yolanda, like, take me as tribute. I'm happy to be anywhere. Show up with your students, show any part of me, like whatever it is that they need to see, because I know it will benefit so much. So I will say that there has been a very, very inquisitive nature here. Where else I've gone, it's just been part of the process. We're doing a pap smear, on to the next.
Right.
So yeah, and then in terms of, I'm sorry, what was your second question?
No, I just wanted to know if there was anything that you thought could help people in terms of the questions to ask when they come in, that that you've asked when you've been in the hospital.
Sure. Yeah. I mean, for me, it's the quality of medicine, something that really surprised me. So there's depot testosterone, and then there's deletestrol. So I've had times where I have not been making as much money as I'd like, and I've had times where I've had full benefits, which had covered my testosterone.
Right.
So in times that I'm not making as much money as I'd like, I've had to go down to the depot Provera testosterone, and I do notice some differences, emotionally, like my reactivity levels. So there's even like some sort of like a class difference,
right,
when you look at like the drugs that you can take. Because I do notice with the deletestrol, I find it a much smoother situation, and it is more expensive by like, I think it's like $25 or something like that. So that's a noticeable difference.
Oh yeah, and that's one of the reasons we have the Compassionate Fund, because a lot of people don't realize the cost of equitable healthcare. There's so much outside of what is covered for trans people, and even things like testosterone and the different types.
I was just saying, yeah, there's like so much again that's not covered, and we talk about OHIP covered surgeries. Like, again, the chest contouring part's not covered. There's a lot of surgeries that aren't covered. Things like electrolysis not covered. So
dialysis,
lots of work to continue to do to increase equitable access.
Yeah. So I'm gonna set up the next question by talking about, like, we want to make sure our audience, has a few tips that they can take away and takeaways, to help them be equipped. So Dr. Stratton, from a point of view of a care provider, what would you like to see as we are building a new healthcare system that is welcoming and for trans people? What would you like to see if we could do it here at Women's College Hospital, or if we could leverage outside of our walls? What are the things that you think are missing?
Yeah, I think having just greater access to care in terms of having healthcare providers, family doctors, primary care providers, take that opportunity to learn more if you don't have that knowledge. There's lots of resources out there now, fortunately, through Rainbow Health Ontario, through KMH, in terms of teaching programs. So it's not too late to learn anything. And as medical professionals, we have ongoing continuing education and medical education requirements. And so taking that onus and time to learn about trans health. This is like absolutely something that's actually quite easy to do and rewarding in terms of prescribing hormones, for example. We use hormones in birth control and postmenopausal cis women. Is not like they're scary drugs or anything like that. So having healthcare providers take that time to learn, and hopefully seeing greater uptake in terms of medical education with learning. And then even just something even more simple and basic is just thinking about inclusive language. So having that opportunity when meeting patients for the first time. So I'll say I'm Dr. Stratton, my first name's Laura, I use she, her pronouns. What name do you prefer that I use, and what pronouns do you use? So having that opportunity to ask about pronouns and name, or whether it's just like a little like badge that has she, her on it, or your pronouns on it, to signal that this is something that's important for your healthcare, and creating that welcoming environment where patients feel comfortable bringing up their healthcare needs to providers.
That's great. It's almost always the simplest and smallest details that make people aware that, they belong and that you see them. So the pronouns is, such a simple opportunity to make people feel seen and heard and acknowledged in the way that they want to. And I think that, I think more and more physicians in particular are starting to pick it up. But, we're having problems in women's health. Like you said, just getting people to talk about hormones and hormone replacement therapy. So we have a long way to go. I know you do quite a bit of education and support that area in family practice. Are you starting to see people asking more questions, physicians asking more questions, wanting more knowledge, wanting to provide that care, wanting to be on the side of equity?
Yeah, there's absolutely that like thirst for knowledge and engagement, and a lot of my colleagues who are asking for help and questions to support their patients, which I'm happy to do. I think it's having patients stay with their family doctor if they're able to, and just having someone to kind of just help support them for their first patient that they're prescribing hormone therapy. And with a lot of the residents, they're very appreciative of learning about trans health, seeing patients who are trans and gender diverse, and asking some really like insightful questions, and just really eager to learn. So there's definitely that appetite that's there. It's just creating those opportunities to learn and then practice it.
It's great to see that we're starting to knock down those barriers. Yuri, perhaps you'd like to weigh in on, what can the system do to be more inclusive and welcoming from your point of view?
Sure, yeah. So as a patient, I'd like to know right away that you can care for me. So personally, I'd like to see some sort of certification. I'd like maybe like some sort of program that a doctor can go through just to understand like the basics of prescribing testosterone, understanding, elongated care, what's going to happen when I'm 85. My doctor knows that. I would like everyone else's doctor to also kind of understand what that would look like. So yeah, I'd like to see some sort of certification. I'd like to be able to walk into a doctor's office and say, oh, if I know someone who's trans and they're looking to get therapy or support, I can reach out to this doctor.
Right. So a little bit of a guide and qualifications so that you can trust the people talking to you.
That you can trust them, and when somebody has something like that posted, they are also wanting to do the work. So It also shows that they have pride in the work that they're doing. And, I'm not trying to create some sort of like division, but I'd rather work with someone who has pride in working with me. Right. So I think that just heightens everything for everybody else in a positive way.
I love that. All right. Last question before we turn it over for questions from the audience, which I can see are coming in. So what would your prescription be for supporting trans health in the healthcare system? Just last words, Dr. Stratton, Laura, what would you say to give people a bit of hope that, we are moving in the right direction? And what would your prescription be for people?
I guess my prescription would be like having, again, your supports around like your community, friends, family, different groups around you. So again, self-advocacy doesn't have to mean you just alone. It can be other people around you can bring to appointments with you to kind of face that power imbalance, and then being armed with some resources. So I think we're going to share some stuff at the end with stuff that you can bring to your primary care provider if they're not knowledgeable, kind of ways to learn, ways to kind of reach out for help, to kind of feel armed when you're going into seeing your primary care provider.
I love that. That we hear that a lot. The power imbalance is what really keeps people away and scared and quiet. And you're so right. Just sometimes having an advocate with you that can support you. I often forget what I'm going to ask the doctor when I walk in there, and I work in healthcare. There's such a power imbalance. There's such a psychological imbalance there. I love that idea. People have said, write down your questions, ask for a longer appointment sometimes, make sure that you have somebody with you who can remember to ask what you forgot to ask and remember what the doctor said. So I think that's great advice. Yuri, what would you say about that?
It's, ask questions. For me, I never knew a lot of the things that I found out unless I asked. And I know that's not easy for everyone to do. But I think it is important to know what can be done for you. Can things go quicker? Can they go slower? Can you start an application for your hysterectomy before you're on testosterone? Can you
Right.
do that for your top surgery? All of these, you might be very surprised about the awesome answers that you get from that. So I think that for me, really shortened my process to ask those questions because I was able to apply for things before being on testosterone. So by the time that I was on testosterone for a year, all of my changes, or at least all of the changes that I desired, had happened. So,
Wow.
things were very quick for me. And it's because, again, I had a doctor who really like slammed that door open. And
I love
considering how
it.
difficult it was for me to get there, it was really special for that to be the outcome because if that all would have been for nothing, it would have just been an awful situation. But I really just, and if you're a trans person, you'd be surprised at people that are in your corner and you'd be surprised at people that want to help you. So, sometimes work is difficult. You don't want to say something, find someone in HR, talk to your manager, someone who you're very close with, explain your situation, and you will be pleasantly surprised by the way that people react to it, truly.
Wonderful advice. So I want to thank you both for sharing your, very intimate and personal insights, as well as, things that, aren't obvious within the system. You've given us lots to think about, some great tips. I'd like to go to the audience now and see if we can answer some of those questions. So Monica's going to ask questions and perhaps you guys can respond. And yes, we are going to have resources at the end that we're going to share. Monica, what do we got in terms of questions?
Okay, great. So our first question is for Dr. Stratton. Dr. Stratton, you mentioned earlier that you did not receive the medical training to support the trans community. Can you talk a bit about where or how you approach seeking out this training?
So, I mean, for my experience, maybe a bit unique in that I sought out additional training through like a PGY3. So this is an additional was a half year of training after my family medicine residency, where it was focused on LGBTQ health. And so there's a very limited number of people who have done this training. So I don't expect that this should be something that everyone goes through by any means. And so that was something that I found was important to myself that I did. But there's other options through even just like clinical experience. Doesn't have to necessarily be like a formalized training program. It's just getting that experience through with working together with like an expert or a colleague to kind of help guide you through and learn. Because again, these are not like challenging medications or hormones. It's just more having that experience and knowing who to ask to help of. And then there's other again training programs that are out there through Rainbow Health Ontario or Project Echo, which again we'll share that people can go through to get extra training. And again, the hope is that through new changes in residency that people do get that training through their standard kind of medical education. That is not something you have to like opt in or kind of seek out. That is part of and integrated into the current education system.
Wonderful. It's good to hear that there are options out there and more doctors are taking advantage of them. Monica, next question.
As a trans ally, what can I do to help trans folks have a better experience within our healthcare system and within our healthcare buildings?
Yuri, what have your friends done that really stood out for you that made a difference? You talked a lot about, you're here alone from Cuba. You don't have blood relatives. Where were the areas where your friends really supported you?
I mean, well, in a clinical setting, I think the most important thing is pronouns. I know it's difficult because there's so many things going on and people are looking at a piece of paper and then they're looking at you and they're backshooting out something. I know it's not the easiest moment to catch yourself, but pronouns are a huge deal. I was in a hospital for about 7 days a few years ago, and it was just constant. It was like a barrage of bullets, like and it was just like, it was very difficult. And again, I know it's not meant in any negativity, but it really impacts your patient. So I think it's very important to ask. I've kept my name from birth, but not every trans person has. So I think it's very important to ask, is this your name? Can I call you this? It's very simple. Some people have very difficult names and are not trans or just from another place or whatever.
Right.
They would prefer a short form, right? So I think it's very important just from a care perspective to ask, is this your name? Do I pronounce it like this? Or how do I pronounce it? And then start that conversation right then and there, because that's how you start that. And that's how you begin.
Trust.
It is how you begin. And I've seen staff do this in like mental settings, like in the mental departments of hospitals, but I've never seen staff do this in emergency settings. And I think it may be due to the heightened situation in an emergency setting. but I think it's very, very important. And then from a friend setting, give advice. A lot of my friends were really wanting to give me advice, and you can just take what you want from that. Literally just take what you want from it. So for me, it was really nice because I just felt like I had a bunch of different suggestions and I could just pick what I wanted to do.
You do what feels right for you. As Dr. Stratton has said so many times, it's such a personal journey. And, we don't talk about it nearly enough. So there isn't enough opportunity to really hear the whole spectrum of what's out there in terms of how you approach different things. Like, I love the way you talk about affirmations and how you start your day. And that works for you. That might not work for somebody else. So people need options. And if they hear them, they can see themselves in those options. I love that. I love that. You're so right.
And I think as an ally too, when we talk about pronouns, like it doesn't have to always be up to the individual to correct that healthcare provider or person who's using the wrong pronouns. If you're a friend, ally, correcting the person who's making that mistake. And so it doesn't have to always be on the onus on the individual to keep on constantly correct healthcare providers or other people, whether it's at work, school, whatever setting. So kind of jumping in like, oh, hey, like they actually use they, them pronouns, not whatever pronouns they used. So it's not always up to that person.
That is so true. To be a true ally, you have to do something when the person's not around. It's not just when they're there. To be a true ally is when they're not in the room that you're supporting them. And when they're not able to defend themselves, you're supporting them. And I think that that's so important. And I think that, it's practice, just like all of us. You fall back into habits. You look at a person and you make an assumption, but it's the practice of, really seeing people and really being, asking people. I love that Yuri was saying, just ask. And you'll know. And it's so simple. And I think that's great advice. Okay, Monica, next one. I think we have time for one or two more. And then.
Okay, great. Has there been any conversations with respect to WPATH 8? The new SOC has identified more procedures as being medically necessary, and it's unclear how, if at all, that will reflect at the provincial level.
Good question. I wish I had an answer. I think with anything to get changed in the government takes a really long time. I don't know, I can't speak for the government. I know there's advocacy work that's happening and very timely right now. I think Kristen Wong-Tam, one of the provincial members of parliament, just passed, I think it's called the Gender Affirming Healthcare Act the other day. So trying to create like an advisory committee to talk about trans care. And so the hope is that some changes will happen with the new WPATH guidance. And for those who don't know, WPATH is the World Professional Association of Transgender Health, if I'm remembering it correctly, but it's the world kind of association creating standards for trans health across the globe. And they just came out with a new standards of practice last month. And so they made some recommendations, and it'll probably take some time for Ontario to adapt some of those changes.
Yeah, one of the great things about Women's is that we already have a very established and strong program. So we are usually on the front lines of, implementation and making sure that we test these things within communities at the community level, and they're not, done without the voices of the community around the table. We have a lot of patient advocacy groups that support, especially in the trans community. We have a lot of patient advocates who inform how we take care of the trans community. We don't assume what the trans community needs. Nothing for us without us. And that is a tenet here. And I love that. And so I'm sure as that legislation gets rolled out, Women's College Hospital will continue to be on the front line. Any final words before I just say a thank you to those who've joined us that you guys would like to share?
I just want to say thank you to everybody. I think just being here is a massive step. And I really appreciate everyone that's in this room today. I hope you take anything from here and pass it on to your colleagues or your friends or the people that are in your lives. And again, thank you. Really appreciate your time.
Well, we're thrilled to have you both here, Dr. Stratton and Yuri. It's invaluable having these conversations. As simple as they seem, they didn't happen just a few years ago. And so for those who want to talk more about this and hear more about this, we will be sending out resources after. If you want to support our program here at Women's College Hospital, please go to our website, and we are happy to talk to you about how you can support this wonderful program. We're also going to have a short survey. And so that'll be next. You'll receive that, and we will hope to get your feedback. and so that we can continue to build on this and see what other events might be possible. Thank you again for sharing this hour with us in conversation with. We wish you a wonderful, wonderful day on behalf of Women's College Hospital and Foundation. Have a wonderful day. Goodbye.
Bye-bye. Thank you.